Beta-HCG, or human chorionic gonadotropin, is a hormone crucial in early pregnancy detection. Understanding its role and the test associated with it can provide valuable health insights. Beta-HCG is a hormone produced by the placenta shortly after a fertilized egg attaches to the uterine lining. Its primary role is to support the corpus luteum, ensuring the production of progesterone, which is vital for maintaining pregnancy during its early stages. The Beta-HCG test measures the level of this hormone in the blood. It is commonly used to confirm pregnancy, as elevated levels are typically present within days of conception. The test involves drawing a blood sample, which is then analyzed in a laboratory to determine the concentration of Beta-HCG. Beyond pregnancy, the Beta-HCG test can be used to diagnose and monitor certain medical conditions. Abnormal levels may indicate ectopic pregnancies, molar pregnancies, or potential miscarriages. Additionally, it can be used to detect certain types of cancers, such as testicular cancer, where elevated levels might be present. The Beta-HCG test is a vital tool in both confirming pregnancy and diagnosing various medical conditions. Understanding its function can aid in early detection and treatment.